projection lines, if the tube is away from the cornea, there's less likely to be endothelial cell loss. And actually, Seo et al. Showed that the density was far more well preserved after 18 months. Long eyes with thin sclera, be careful with the pass that you make. Bear in mind also the size of the plate. If we're going to put it in the superior nasal quadrant, for example, there's a potential for inducing an iatrogenic brown. The importance of mentioning that is when we're doing this kind of procedure, the vitreous base needs to be removed. Otherwise, it will block the tube and you will have a failure. Occasionally, indented vitrectomy, which is not something that you say that actually, like Alex, you've just described, in both of those case series, they didn't use the dedicated Hoffman elbow pass plane, which I use in Oxford, and they just shaped it on the table. The key thing to try to avoid hypotony in that situation is not to put it in the sclerostomy sites where you've done the vitrectomy, because if there's a smaller lumen around, that would have to be sutured into make a different lumen adjacent to that. If we're going to tube through there, that would be the better. Plate out.
I don't take the plate out. And oftentimes,
which I as well.
Oftentimes I won't amputate the tube. Life is long. I don't know what's going to happen. So I'll convert it to a stage 1, tucking the tube underneath. And I can say, like others on this conference, I've been doing it so long that I've had the need in the future to go back to that plate and put it in the pars plana for something else. You know, the person's had detachment or something, and I'm like, oh, God, I still have that tube there, and I'm able to put it in. And we don't use the Hoffman. I think it would be nice if we had it, but we don't have it. And I do, as Elena said, I do direct mine a little bit more anterior than what a normal sclerotomy would be for a.
And Gurjeet?
Well, one is if the pars plana tube is in play, make sure the vitreous base is moved. Pearl 2, may the force be with you.